A new law in Washington state aims to make it easier for patients to ask for and receive aid in dying, also known as doctor-assisted suicide. The controversial Death with Dignity bill will cut down the wait time between when patients first ask for life-ending medication and when they can actually receive it. The new legislation also lets more kinds of healthcare providers sign off on the requests and also allows the necessary drugs to be mailed to patients rather than picking it up in person. That law takes effect on July 23rd. And in total, 10 states plus D.C. have laws allowing medically assisted death, and Massachusetts is set to revisit the topic in coming months. Some family members of people with terminal illnesses say restrictions can be a barrier to patients ending their lives on their own terms. But there are critics who say those barriers are meant as safeguards to make sure people are truly ready to die. It's a big topic, and to unpack all of this, I do want to bring in two experts. Dr. Shikha Jain is a hematology and oncology physician. Dr. Leigh Vinocur is an emergency physician and expert on working with medical providers as well. Thank you both for being here, and I'll jump in with you, Dr. Jain. You know, in your work in oncology, you likely see too many patients with terminal diagnoses. How important are these traditional safeguards, or in your experience, do patients usually know when they're ready to go?
It's a great question. And I think that it's really important to remember that a lot of times patients are suffering, they're in pain, they're nauseated, they're miserable. And there comes a point where they are suffering, and their suffering is so much that they do deserve the right to be able to make that decision about how they would like to spend their final days. So I think these types of topics are really important to discuss. And I think these types of opportunities for patients, their family members, their caregivers to make that decision and allow them to die with dignity and live their last few days how they choose, I think is incredibly important. And while safeguards are necessary, we need to make sure the safeguards aren't preventing patients from allowing to be living their lives the way they see best and the way they can manage their symptoms and the end of their life.
Yeah, certainly. How important is it, Dr. Jain, if we stay with you for just one moment, to make sure that these patients have access to adequate pain medication and management in these final days, that this isn't simply a reaction to just not being able to handle that level of distress?
That's incredibly important, and we have phenomenal opportunities to get patients involved with palliative care and hospice care, where hospice care can actually be delivered in your home, where, as I tell my cancer patients, we go from aggressively treating the cancer to aggressively treating the symptoms, and that is incredibly important. So that's pain, that's nausea, that's constipation, anything that you can suffer, and you can get that care in your own home. And so enrolling patients in hospice care early on and making sure they have adequate access to pain medications and other medications is incredibly important.
Yeah, sure. And Dr. Vinocur, I want to bring you in here. In the ER, I know you see so many patients and their families really in some of the scariest moments. What significance does this bill hold for the families of terminal patients, do you think?
Yeah, I think it's important. Dr. Jain is right. As an oncologist, she sees a lot of those patients, but it's very sad in the ER. Oftentimes I'll see patients whose family bring them in at the very end because they panic too when it's not the patient's wishes. So it's critically important to have advanced directives ahead of time, talk to your oncologist like Dr. Jain, make sure everything's written out, and to prevent those barriers, because people come in and they're in anguish. They wanted to be dying at home and their families bring them in. So laws like this are critical. And the fact that it was voted in years ago in Washington state tells you how important it is for people to have control at the end of their life.
I appreciate these perspectives.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.